I would like to invite Chair Redman to make some remarks.
Good morning. It's hard to believe how much has changed in the world, in Canada, and in our community in only a week. These are unprecedented and extremely challenging times, but I have seen so many people in our community playing crucial roles to keep community running during this health crisis. There are many thousands of public sector employees, including 2,500 regional employees, staff, who are working hard to maintain a wide variety of critical programs and services. For the region, this includes massive public health response to our whole community, and we should be proud of that. We're also keeping our paramedics on the road and maintaining programs for the vulnerable and homeless citizens, keeping our buses running and our trains running, caring for seniors at Sunnyside Home, and keeping crucial infrastructure roads, like roads, bridges, and water treatment plants operational and safe. Waterloo Region's many healthcare workers are working around the clock to keep us safe and respond to this extremely challenging health crisis. There are also thousands of people out in the community who are making sure we have food, medicine, and other essential supplies. So a shout out to our grocery store workers, pharmacists, truck drivers, gas station attendants, and coffee shop staff. To the citizens of Waterloo Region, I truly want to thank you. You are playing an important role as well. For many of you, that means staying home, socially distancing from others, staying informed, staying calm, and being patient. Once again, the situation is changing rapidly, so continue to monitor public health's website, Region of Waterloo, all one word, .ca/COVID-19. These are challenging times for our community, but we are in this together and we will persevere. Thank you so much for your cooperation and everything you're doing to make sure everybody in the community is included. I would now like to pass the mic over to Dr. Wayne.
Thank you, Chair Redman. Good morning, all. So before I provide this morning's public health update, I would like to echo what Chair Redman said. It certainly is a challenging time for our community, but we are rising to that challenge. So many of you have been following the recommendations that we have promoted. We know this hasn't been easy, but let me express to you that we really appreciate your actions and they are making a difference. Thank you very much. I will now provide an update on our cases. As of this morning, we have 2 new cases of COVID-19 in Waterloo Region. One of these 2 new cases is currently hospitalized. This means that in total, we have 14 cases that have been confirmed positive. The total number we have tested is 667. Of that number, 385 have been confirmed negative. We have pending test results on 268 cases, and 282 individuals are being monitored by public health. As a further update, case 3 has now left the hospital, which means we have 1 hospitalized case among the 14, and the others are self-isolating at home. Here is the update on the 2 new cases, cases 13 and 14. Case 13, this individual was hospitalized at St. Mary's General Hospital, and he was identified as a case of COVID-19 through the increased testing that we're now doing for hospitalized individuals. He has other health conditions. We received the confirmation yesterday, and this individual remains in hospital in serious but stable condition. Case 14, this individual was on the cruise ship Celebrity Summit. She is one of the now 5 cases that we have that are linked to the Celebrity Summit, or to those who are on the cruise. She has been in self-isolation since her return. I want to remind our community that accurate and timely information is provided on Region of Waterloo Public Health's website at regionofwaterloo.ca/COVID-19, COVID-19. On our website, you will find a self-assessment tool. This provides advice on what to do if you have symptoms that could be COVID-19, and advice on what to do if you have been in close contact or believe you have been in close contact with somebody who may have COVID-19. So please make use of this tool. It can help inform you on whether you need further care. As we go into the weekend, I want to provide some quick but important reminders on best practices. If you return to Canada before March the 15th, you are not required to self-isolate unless you have symptoms. But you may choose to do so, but we are not saying you need to. But at the least, you need to carefully monitor yourself until it's been 14 days since you returned to Canada. If you are returning from March break travel outside of Canada on or after March 15th, you need to self-isolate for 14 days. I also want to remind everyone that if you have symptoms but have not traveled or had close contact with a confirmed case, you still need to self-isolate. Stay at home. Avoid close contact with others, including others in your home. And if you develop symptoms, you should remain at home in self-isolation until it's been either 24 hours since you no longer have symptoms, or it's been 10 days since you started having symptoms, whichever is longer. Finally, I want to provide clear information on a question that I've been asked. That question is, should I attend or hold a gathering of 50 people or less? The answer is, ask yourself, do I really need to attend this gathering? If the answer is no, then please do not attend or hold such gatherings. Instead, you could virtually meet up with your friends and practice social distancing whenever you can. What we are seeing is that people are doing their part. As I mentioned earlier, and Chair Redman mentioned earlier, we are very appreciative of that. And what I can tell you is that every little bit helps. Thank you. I'll now pass the mic to CAO Mike Murray.
Well, thank you, Dr. Wong and Chair Redman. So I'll provide an update on a couple of different matters. So in addition to my role as Regional CAO, I also chair the Regional Pandemic Control Group. And I would echo what Chair Redman and Dr. Wong have said, and that is the Pandemic Control Group and a number of related working groups have shown tremendous energy this week, tremendous collaboration, cooperation, to make sure that all aspects of the pandemic response are being dealt with in a coordinated way. So I'm going to provide updates on a couple of different categories of work that are going on. We have a municipal control group that consists of myself and the CAOs from the 7 area municipalities. We've been working on several things, so I'll give you an update on work that the municipal control group has done. And secondly, there's a significant effort underway with a community supports group. And I'll give a couple of quick updates about work that the community supports group is doing. So first off, on the municipal group, there are a couple of things that have evolved over the course of the week. One is related to transit. and I think that was communicated within the last couple days. Grand River Transit on our buses has moved to rear door boarding for all of our buses, and so we're requiring that passengers who are able to enter and leave the bus through the rear doors, and that is part of social distancing. It keeps a respectful distance between passengers and the bus operators and keeps everybody safe. People with mobility challenges who are using Grand River Transit buses can still enter via the front door because that's where the ramp is to assist people with mobility challenges. So that's transit. Second area that was communicated today, this week, was some changes to waste collection. And again, these are measures to, again, try to keep everybody safe, including the people who are picking up our recycling and garbage. So some of the things that are being requested is placing used tissues and napkins in the garbage rather than the green bin, using liner bags, paper or compostable in the green bin, putting all garbage in garbage bags, not loose in garbage cans, and if you are sick, placing any items that have come in contact with your mouth, nose, or eyes into the garbage. This includes items that you would normally put in the blue box, such as water bottles, pop cans, milk juice. And by taking some of these simple measures, it will help keep safe the people who are working hard collecting our garbage and our recycling. Third area on behalf of the municipal control group that I want to mention relates to municipal playgrounds. The area municipalities all operate a number of playgrounds, and they are making a change to the status of playgrounds. So all the area municipalities recognize that parents and caregivers are looking for outdoor activities to keep their children occupied. However, based on the strong direction from public health that everyone should continue to practice social distancing, and because municipal staff can't effectively clean and disinfect multiple surfaces and play structures located throughout the region, and out of an abundance of caution, all area municipalities in the region are taking steps to close their outdoor playgrounds and skate parks at least until April the 5th. So therefore, beginning today, municipal staff will be out posting signs indicating that municipal playgrounds throughout the region are closed. The area municipalities are asking parents, caregivers, and children to follow this direction until the closure is lifted. Parks, trails, open spaces remain open, and people in the community are encouraged to practice social distancing protocols while enjoying these outdoor spaces. Those are updates from the municipal group related to transit, waste collection, and playgrounds. I'll now turn to a few updates on behalf of the community support group. And this is a network of regional staff, area municipal staff, and many community partners who provide really critical services to a broad cross-section of people in the community. They have been meeting frequently this week. They are focused on how do we make sure that street-involved people in our community, marginalized people in our community, are kept healthy and safe throughout the pandemic period. They are focusing on three critical priorities right now. One is creating an isolation shelter for people experiencing homelessness who may need to be placed in isolation. And we anticipate that within the next 12 to 24 hours, we will have that solved and we'll be able to announce an isolation shelter has been put in place. So that's one priority. Another priority is looking for spaces for daytime activity or daytime shelter for people who are street involved, people who are homeless. And so lots of work is going on to try to identify some physical locations where people can go and rest, perhaps get a bite to eat, use washrooms during the day. And these are folks who, many of the places where they typically would spend some time during the day, all those doors are locked to them. And so we're very sensitive to these people need a place to spend some time during the day that's safe and healthy for them. So that's a second priority that the group is working on. And the third priority that the group is working on is to make sure that, again, people who are homeless and street involved have access to food. And some of the normal ways that they currently access food are not as available to them. And so lots of work going on to try to make sure that they have access to safe and healthy food during this difficult time. We anticipate that there'll be more information about those three issues probably in the next 12 to 24 hours. And for sure in our briefing on Monday, we'll be able to report on the solutions that have been put in place in those areas. So that's my update on behalf of the control group, and I think I'll turn it over to Brian to moderate questions and answers.
Thank you, Mike. Now I would like to invite questions. Kate from CBC.
Thanks, Brian. Just going back, Dr. Wong, to the hospitalized case, just so we're clear, was the gentleman in the hospital already and then he contracted the virus?
He was already in the hospital, and now that we are testing more broadly people that are already in a hospital, he was tested and he tested positive. So it doesn't mean that he contracted it at the hospital, it just means that he was diagnosed while he was hospitalized. So it's a good thing, because now we're detecting them in hospital where they need to be detected if they have it.
Right, and so on the website he's listed as community, so it's not really clear where he may have picked it up, is that
That's
correct?
right. At this point in time, we do not have a link with travel or with contact with another case, and so until it's proven otherwise, we consider those community acquired.
Okay, and yesterday we were talking about case number 12 who went to the Toronto Assessment Center.
Yes, thank
Do we
you.
have any more details on that case?
Yes, thank you. So that case is someone that lives both in Waterloo region and Toronto, but mostly in Toronto. So she was tested in Toronto, and we've followed up, and she has a small number of contacts here in Waterloo region. She also has contacts in Toronto, and we have forwarded the information regarding her Toronto contacts to Toronto Public Health for their follow-up there.
Okay, and quickly just over to Mike for a second. With the playground closures, is that it's just going to be signs? We're not going to see like yellow tape up and stuff like that?
Yeah.
Or will it be based on the municipality?
I think each municipality may take their own approach. What I have heard from the area municipal CAOs is the current plan is to sign them. Their view was yellow tape might not stay up for very long, and the resources to be going out and trying to make sure the tape was up. They have, I think, right across the region, municipal playgrounds. I think there's like 400 of them. So the effort involved in, signing them and trying to maintain, cordon off would be pretty significant. So at the very least, they are all going to be signed.
Great. And sorry, Dr. Wong, back to you. We keep hearing cases where people have no symptoms, and they may be spreading things. Is there any advice for people who, they just don't know if they have it? I mean, I guess that's the social distancing part of this, but are you guys getting a sense at Public Health of how many cases might be out there that, people just aren't feeling those symptoms?
Thank you for the question, Kate. So the primary means by which people contract COVID-19 is really through contact with someone who is symptomatic. There are really no cases among our cases that contracted it through someone who is asymptomatic and then later, say, tested positive. So we don't have any evidence of that among our cases. And, I know that we have had isolated reports throughout the world of, cases that may have been asymptomatic and may have transmitted to others. But if we look at the body of evidence overall, transmission is primarily still through people who develop symptoms. So the reason we ask people to self-isolate is so that when they start to develop symptoms, they're already in self-isolation. So I hope that helps.
Yeah, it does. And my last question is just, people are being very vigilant right now, but it's still very new. We're maybe a week into this for some people,
For sure.
days for others. Is there any worry that people are going to lapse on this and be like, okay, fine, it's almost 2 weeks, we're fine, let's just go outside?
Yes, it's understandable that these are extraordinary measures, and people are really wanting to do the right thing, but it can become challenging, more challenging over time. I would say, yeah, that is something obviously that we can understand. That said, these recommendations regarding social distancing, regarding avoiding gatherings, they're not for 14 days only. They are for as long as we need to have them in place. And at this point in time, we don't know exactly when we would lift those. But for travelers, you're correct that if they have returned from outside Canada on or after March 15th, and they are asymptomatic, they are still to self-isolate, and this for 14 days. So for some people, it is a self-isolation for 14 days, but in terms of the general recommendation for everyone to practice social distancing and to avoid gatherings if they can, that is for an indeterminate amount of time for now.
Okay, and so should people just put that out of their head? Because I know people I talk to, they're like, well, the kids are going back to school in 2 weeks, Places will open again in 2 weeks.
Yeah.
Is that likely to be extended then?
So at this point, we don't know. We need to monitor this carefully, along with the province, who is really kind of overseeing the entire situation in Ontario. What we know is that those facilities and schools have been closed until that date, but we don't know whether or not that will be extended at this time. So I just encourage people to just, for now, just assume they need to continue to do this until they're told that they no longer need to.
Great. Thank you very much.
Thank you, Kate.
I have a question. It's Catherine Thompson calling from the Record.
Hi, Catherine.
Oh, hi, Julie. I just wondered if you could just clarify a bit with regard to this case that's in hospital.
Yes.
So obviously other people in hospital are also vulnerable.
Yes.
Can you just clarify how public health and the hospital are handling any risk to other patients who may be in hospital?
Yes. So once this case was diagnosed, the hospital, who's responsible for investigating potential contacts in the hospital environment, they have, begun their investigation. And if there are other cases in the hospital that are associated with this case, then we would find out, because public health gets notification of all confirmed cases. But at this time, we don't have other known associated cases with case 13.
Right. I guess I'm just looking for some kind of clarification about whether this person has been isolated.
Oh yes. Oh yes. They are in appropriate isolation in the hospital environment. Yes.
So there's no risk to other people who are in hospital. I just want to, if you can provide any reassurance you can provide to
Sure.
other people who have loved ones at St. Mary's.
Sure. Right. Generally, what we see are good practices in the hospital environment, and they will take precautions with people who present with respiratory symptoms even before they know what the diagnosis is. So at this point in time, we have no evidence that there's been something that didn't happen like the way it should have, and so the hospital will look into this to make sure that's the case. But for sure, now the person has been diagnosed, the hospital will ensure that the appropriate precautions for this person are put in place, or have been put in place. Generally in the hospital environment, Catherine, They sort of, it doesn't take a particular diagnosis to actually action things. They do put in place precautions, as a function of people's symptoms in order to try to, make sure that it's safe for other patients and workers.
Okay, so I mean, I'm just trying to make sure I understand. So you're saying that because this person presented with respiratory issues to hospital, the hospital staff dealt with it as if it could have potentially been COVID?
That is
That what you're
that is what usually happens in hospital, but
Right.
the hospital is going to investigate this thoroughly and make sure that was the case. And if not, they would inform other people if needed. But generally, that's what happens. Yes.
Okay, thank you. Another question I had, Mike, is you talked about notification within 12 to 24 hours with regard to vulnerable people in the community, such as homeless people and street people. How will that notification take place if decisions are made within 12 to 24 hours?
Yeah, and good question. You know what? It may depend on different of these issues may be communicated in different ways. So, if it's urgent, it may be done through a media release. If it's less urgent, it may be part of our media briefing on Monday.
Okay.
And other social media channels. And it may come from the region. It may come from other community partners who are taking immediate action.
Okay, thanks.
Thanks, Catherine. Astra from 570.
Hi there. So the Ontario website now has 2 more local cases posted. That's case 15 and 16. What information do we have on those cases?
Okay. I have 14 here, so it's possible that they came in since, in the last hour or so. It's possible. I will have to go back and confirm with my team. But what I have in terms of information about the cases that we have to date is what I've mentioned earlier.
All right, no worries. So we can expect to, hear a little more about it tomorrow, perhaps?
Or Monday. It depends on if there's anything significant related to these cases that we feel we need to communicate broadly to our community about or not. If not, if it's just a simple case count update, then that would be Monday at the regular press briefing. So it's possible, because all this is happening really quickly, it's possible, that there's a little bit of a lag between the provincial the provincial numbers and our numbers. I mean, earlier this week we were a little bit ahead of the province, so it can be a little bit either way.
All right, thank you for that. And as you know, spring officially arrived last night. Will this have an impact on how COVID-19 spreads in the community at all?
We don't know that at this time. So we don't know that at this time. We'll have to monitor.
So there is no information at this point on whether warmer temperatures help, kill the virus, because this is a rumor that's has spread through the community that once it gets warmer, it's all going to get better. At this point, that's not accurate.
Yes, you're right, Ashta. That's a common thing that we hear, talked about, and people, I think, maybe make that assumption because that's what usually happens with flu. Flu tends to go away with warmer weather and other respiratory viruses. For COVID-19, we do not know how it will evolve in the next weeks, which is why I'm asking people to not stop the social distancing measures that we've recommended, even when the weather gets warmer.
All right, perfect. And a lot of things have been happening, almost like a domino effect across our community. For instance, the Cambridge Toyota plant announced they'll be shutting down until April 6th. GRT buses also boarding from the back door until the 5th. And local playgrounds are now also closed until April 5th, as Mike Murray mentioned. Do you think this is long enough? Is that around the time when residents should consider self-isolating as well?
I think that if residents are concerned and they wish to self-isolate themselves, then, you know, they can definitely go ahead and do that. The general recommendation, the general principle that I would like people to keep in mind is we want to try to ensure that people can socially distance themselves from others. We want to ensure we don't have crowding, don't have gatherings with lots of people. Those are the basic recommendations that we're asking people to follow. And if everyone follows that, that's already going to be good. But we understand that people may want to take this further, and they may want to potentially self-isolate themselves because they may feel perhaps more vulnerable, for example. If they feel more comfortable, definitely, you know, they can go ahead and do that.
So this level of self-isolation that we have going on right now, do you think it would be necessary past April 5th?
It's not possible at this point to say. So we'll have to monitor this closely, see what the evolution is like in our region as well as across the province in Canada, and we will keep you updated.
All right, and so that means as this evolves and as we continue to learn more about it, local businesses may have to consider being closed for longer than past April 6th or April 5th.
Yes, there's that possibility.
All right, thank you. Those are all my questions.
Thank you.
Thank you, Ashta. Matt from Global.
Just a couple here. What is the current wait time for confirming tests?
Hi. So we understand, we've been hearing that there's been some prolonged wait time for receiving results. So there can be a range. It can be something like, for example, as early as 48 hours, but it can also be, what we've heard is it can be up to like 5 days or a little more. So right now, it seems as if it's taking a bit longer than it used to get the test results. That said, I also am aware that the province is very aware of this and is working to increase testing capacity so that results can come back sooner.
And do we know the status of case number 1? I believe it's been over 2 weeks now, so is she still self-isolating?
Yes. Case number 1 is still self-isolating. 4 cases that have been diagnosed, we are in Ontario right now needing to do confirmatory tests, 2 of them, in order to ensure that they no longer carry the virus. And so case number 1 is, is recovering. She's going in the right direction, but she's not at the point yet where we can say that she is no longer carrying the virus.
So, sorry, you mentioned there the number 2. So, are we expecting to hear some recoveries soon, within the next days?
We'll have to see. But we certainly expect, given the number that are self-isolating and recovering, that we will see some cases no longer listed as cases once they have those 2 confirmatory tests. That said, I think, as you may have seen across Ontario and the country, it takes a while for cases that have been diagnosed to actually be removed from that list of cases, because it takes those 2 confirmatory tests. So it takes a little longer because of that, even if they've, they're recovering really well.
So how does that process work? For example, for somebody who is self-isolating, would a health official show up to wherever they're isolating and run the test, or is there another another test that you're doing on people to determine if they have the virus? Is it that sort of thing, and then going through that wait time to wait for those test results?
It's that it's the same test, and once somebody no longer has any symptoms, then we would start the process for testing. And you're right, it takes 2 tests, so there's a little bit of wait associated with that. If right now it's taking a little longer, then we hope for the test results to come back. There's a lot of people that are being tested across Ontario right now, which is one of the reasons it's taking longer to get test results.
Thank you. Those are all my questions.
Thank you.
I'd like to wrap up by again thanking the local media for, sorry, Dan from CTV. My apologies, Dan, sorry.
From the doctor. So Toronto Public Health is pushing to have nail salons and hair salons closed. Do you see, or do you want to see businesses like that close, and when?
What I'm asking all businesses in Waterloo Region to do is to arrange their business operations in such a way that they're able to allow their clients to maintain social distancing. That is the minimum requirement that I'm asking them to do, and to avoid crowding in their establishments. So some businesses may choose to go further than that, but at this point in time, those are my recommendations for businesses here.
Can you tell us what case number the AGF rebar case is? We heard last night that.
Yeah, so that case is not one of our 14 cases. It is a case that was diagnosed by Peel Public Health, Region of Peel Public Health, because the resident is in their jurisdiction. So they would be managing the case and the contacts there, and if there are contacts from that workplace that live here and that need follow-up by public health, Peel Public Health will refer them to us.
So that person doesn't live in the region?
No.
What other companies are being notified by public health?
We wouldn't notify companies. We would notify individuals who have tested positive. And if they're in our jurisdiction and there's a workplace exposure that we think needs to be looked into, then we would work with that person's employer to put in place whatever investigation we need to do to assess the level of workplace exposure and whether other workers need to be informed. What happens sometimes, though, is once a company finds out that one of their employees has tested positive, they themselves will send out letters. They themselves will make decisions for their operations, which is their decision and is fine. But they could do things like shut operations down, send out letters to their employees. So that would be the employer's decision.
And can you clarify which cases are connected to these letters?
There are 5 cases that are connected. I don't have my sheet with me right now with all the case information, but we can get that to you. Dan, is that your name? Yes. Yes, we can get that to you.
Yeah. Thanks, Dan. Appreciate those questions. Again, this concludes our briefing today. We'd like to thank our local media partners for participating in this very important briefing and presenting good quality sound information to our community. And on that note, this concludes our briefing. Thank you.